Hi, I'm Dr. Peter Coleman, a retired addiction medicine specialist. And today we're going to be talking about how the drugs that people use actually injure and change the reward system in the brain. You know, the reward system is the area deep in the brain that's full of dopamine, and dopamine gets released in extra high amounts when people use addictive drugs. But that process actually injures and changes the reward system. Gets worse and worse as the disease goes on. All three classes of drugs all release dopamine in the reward system, so they all get there through slightly different mechanisms, but opioids, of course, get there through the endorphin system. They attach to those endorphin receptors, which then go on to the reward system. Cocaine and the stimulants have more direct effects, and alcohol and the sedatives have effects, but they all end up in the reward system and release that extra dopamine. One of the first effects that happens when people get this high dopamine effect is that natural rewards stop losing some of their value. I mean, it's pretty hard to compete when you've got this extra amount of dopamine coming from the drugs. If you're trying to look at a sunset or enjoy exercise or sport or other learning new activities that we know do release dopamine, but in much smaller amounts and more natural amounts. So even natural foods start losing their ability to be meaningful to the person. The second thing that happens is that repeated drug use releases a little bit less dopamine each time. So the first spike is really high, the next spike not quite so high, and it gets worse and worse as time goes on. A patient came in to see me from Northern Virginia, Stephanie, and she'd been using drugs for about 4 or 5 years, and she said, it's horrible. I have to shoot up heroin every day, 3 or 4 times a day, and I don't get high at all, nothing. You know, I just feel miserable if I don't use. I have withdrawal symptoms, but I'm just not getting high. And when you talk to patients who've been on opioids for a long time, they'll tell you almost the same thing. They just don't even enjoy it anymore. One of the most cruel things, they were using this drug that made them feel so good, and now they have to use it, have to do all the horrible things that come along with their drug life, but they're not getting high at all. As the dopamine is having less of a spike, it starts dropping below the normal baseline, so that what happens is people don't get very high, and it gets worse, but they start falling below the baseline of a normal person, so that when they don't use, they feel the negative effect, the opposite effect of feeling high. They feel miserable. And that gets worse and worse over time as well, so that after a while, people are really living below a normal baseline. Worse than that, they get physically dependent on the opioids because their endorphin system also gets depleted. So now they're having withdrawal symptoms every time that they're using. So they have to, when they're not using, so they have to use just in order to feel halfway normal. They don't get high when they're using. It's really cruel. The good news is that with recovery, all of this goes back to normal. People's endorphins levels comes back to normal. It takes some time, and we'll talk about that in future videos. But it does go back to normal. Our dopamine levels start regenerating themselves, and so normal things start becoming pleasurable again. Over time, we start appreciating normal dopamine, and we start realizing there's so much joy and pleasure from normal things in life. And so we can go on to lead normal, happy, healthy lives. We just need to get into recovery.